Serious, doctors of Reddit, what is the most stupid thing a patient has said trying to correct you? Mom of baby, I don't vaccinate. It's against my religion. Me. Oh, really? Just out of curiosity. What religion is that? Mom, I'm Catholic. Not really a correction per se, but made me laugh a lot. Ophthalmologist here. Told patient he needed reading glasses which he didn't believe. I explained that everyone develops presbyopia eventually. Come on. George Clooney doesn't wear reading glasses. A. Yes he doesn't. B. Not sure why you are comparing yourself with him. Had a female patient. Her mom asked me to adjust her scrotum. Trying not to burst out laughing. I said your daughter's scrotum? She acted like I was stupid and pointed to the back of her neck. I knew she wouldn't listen as she was so convinced, so I stopped arguing with her. And I also wanted her to go around saying it to other people. I'm a doctor. But this was my nonna, not a patient. She was drinking 11 cups of coffee a day, which is too much. We held an intervention while visiting for dinner, and when we told her she was addicted she responded, no, the coffee is good for me. It helps me with my shaking. She cut down once we explained to her what drug withdrawal was. The time I was telling the family that the patient is going to die and her lab results, pH 6.6, lactic acid 25, are not compatible with life, and they said they were pretty sure she would wake up if I put ice in her underpants. Well, yeah, we are not going to do that. She died and they still didn't believe me she was dead. They kept trying to wake her up. Had a patient come into the ED for what was essentially a cold. Kept requesting antibiotics. Kept explaining that they wouldn't help her viral symptoms. But I did then sit down and give her a basic tutorial on the differences between bacteria and viruses, and antibiotics and antivirals. Hopefully it was enough to help her in medical school finals the next week. Edit. Thank you for all the upvotes. I have surpassed my husband on his upvotes in awe. A memorable lady was utterly convinced that her friend got cancer because she quit smoking, not because she is a smoker. Duh. This lady had a mild goiter, and her reason for not quitting was that if she quit smoking the lumps in my neck would turn to cancer. Could not be convinced otherwise. Then I referred her to Ent for her hoarse voice, and she was surprised how fast she was seen. I said, well, you're a smoker, so they were worried you might have throat cancer. Smoking causes throat cancer. I always needed a strong coffee after her. Why are you looking at my hip? I said the pain was in my knee. Gynecologist here. Imagine a revved up version of that dreadlocked beanie wearing woman meme. It's not vagina anymore. It's pronounced vazhe now. I asked a patient complaining of dizziness if she had ever been diagnosed with vertigo. The daughter chimed in and said no, she's a Libra. I then laughed hysterically at her awesome joke. She was dead serious. I took care of a child that got chickenpox. The mother was strongly anti-vax but was yelling at me, how can modern medicine not have a treatment for chickenpox? She couldn't grasp the concept that we do. She just refused it for her child. Probably the legions of women that seemingly don't know how long it can take for an IUD to work and want it taken out cause it didn't instantly stop their periods within a month. Also the women that come in with chlamydia but deny having had sex. Like, come on, I'm not your boyfriend. You don't need to lie to me. Lady comes in with shortness of breath. We check her troponin levels. They're elevated. Mom, you're having a heart attack. No, I'm not. Yes, you are. No, I'm not. Her PCP came into the ER and fired her as his patient. She signed in against medical advice and left. She died the next day of a ducking heart attack. Yeah. Had an extremely frustrating dialogue with one. Took about 45 minutes and got nowhere. The gist. I keep gaining weight even though I don't eat anything. That's against the laws of physics. But it's happening to me. I tried a diet where I ate 800 calories per day for 2 weeks and gained 5 kilograms. So those laws don't apply to me. I don't believe you. So you're calling me a liar? I eventually proceeded to tell the person that if they were really generating mass out of thin air, then scientists around the world would want to study the phenomenon. The only time I have ever almost lost my temper with a patient. Oh, also, Well, Jezebel says you can get chlamydia from toilet seats. I didn't have a heart attack. I had a myocardial infarction. That's what a heart attack is, chief. Might be late to this, but a 17-year-old girl who was pregnant and came into the emergency department to get checked as she was punched in the stomach. She wanted to go out for a smoke, so I did the whole pregnancy and smoking spiel. She stopped me and told me I knew nothing as the baby would be harmed if she stopped smoking straight away. Radiographer here and had the ED doctor give me a request for soft tissue neck x-rays and the doctor was much like don't question it, just do it. Anyway, after that patient had left, the EDDR came and told me that the gentleman presented to ED at 3 AM because he had hot milk 3 days ago and his tongue has been hurting ever since. The patient basically burnt his tongue but was insisting on a x-ray to ensure nothing is wrong. Woman with this weird abdominal cramping, twitching presentation. I won't say stupid because she probably had some kind of undiagnosed dementia, but definitely the most bizarre. Ask her what she is feeling, why she's twitching her abdomen. It's like it's trying to get out. Like what's trying to get out, mom? My sperm. Mom, you don't have sperm. Oh, for those of you curious, by the time I saw her last official diagnosis was pseudoseizures. She had a tendency to start twitching parts of her body whenever we would start asking whether she had twitching in those areas. Mom, have you had any twitching in your legs? She looks at leg. Leg starts twitching. Yeah, I have. Veterinarian here. The anti-vax movement has been slowly seeping into my profession for years, but in my area it's gotten much worse recently. Almost every day now I have a client inform me on how toxic vaccines are and that I should talk to their dog's breeder because she is very informed. Most of the time I'm able to convince them that this is incorrect. However, some are still quite resistant. Vaccinating for rabies is not just a suggestion. It is the law. And my clinic has a policy that we don't let any of our healthy animals be vaccine free. I've had a few clients walk out over this policy. I feel bad for their animals. These are the same kinds of clients that won't use flea and tick prevention on their obviously flea infested dog but will use lemongrass and peppermint instead. Spoiler, it doesn't work. Me, sir, I need to know why you stopped taking your antiretrovirals for your HIV. Him, well, I met this witch online that. Me, wait, did you just said witch? Him, yeah, she sent me a bunch of herbs every month to cure my HIV, and they worked. Last time I checked I was cured. Me, where and what test did you do to know you were cured? Him, I made an online test that the witch told me to. There were a lot of random questions but in the end it said that I was free of HIV. Me, look, we will need to do a blood test to confirm that. Now, can you tell me which herbs were you consuming? Him, I don't know the name, but I have them right here. Points at his backpack. Me, may I take a look? Him, sure. I opened the bag and what I saw was nothing but grinded oregano with something that smelled like chlorine. The patient, sadly, died from a severe sepsis a month later with a highly resistant microorganism, just because a witch in a website told him to stop taking his meds. It's really sad when it happens, but when I have to explain to people that their limbs aren't growing back. Saw a lady pre-operatively for removal of melanoma. Advise sunscreen usage. I never use that stuff. I think it causes skin cancer. Med student, but a patient was telling me about how a doctor suggested she may have shingles of the eye, trying to get me to laugh at the other doctor because apparently shingles of the eye is a ridiculous concept. You can totally get shingles in your eye, though. When I was shadowing in a PEDS unit, a doc told me how a father of a newborn was against vaccines. Even VitK because he thought the preservatives in them were harmful as he was eating a bag of duck-eyed Doritos. Family came in like a day later because the kid was about to bleed out. Edit, spelling. 20-year-old girl and her fiancé registered sign find out that she's pregnant. Me, partway through taking her history. Do you smoke cigarettes? Her, yay. About a pack a day. Me, you should definitely stop that. Her, well, my sister told me that if I stopped smoking, the baby would go into withdrawal and die. Me, what? Don't smoke if you're pregnant or planning on becoming pregnant. It's never too late to quit. While I am a doctor, this happened to my wife, also a doctor. Female PT came in complaining of infertility. Said she and her partner had been trying to conceive for like 5 years and had tried everything. At one point she let the pronouns slip, she and I, and my wife said, "Wait, let's back up a minute." Turns out the woman had been in a hetero relationship for a few years and never got pregnant despite using no protection. She then entered a same-sex relationship and again never got pregnant even though she really wanted to, leading her to believe she was infertile. When my wife tried to explain that conception requires sperm, sourced from a male, as well as an egg, the PT was incredulous and exclaimed that she didn't need a man in my life and she didn't like being judged. Perhaps needless to say the patient was lost to follow-up. Med student here, but I have had 2 winners. When discussing a precancerous skin lesion on a patient, they opted to use their laser ray instead of classic treatment. It was a cancer laser ray that was bought online. It also apparently had frequencies for arthritis. They insisted that the vibratory frequency can be tuned to destroy cancer cells, just like a trained singer may be able to use her voice to break a crystal glass. The patient did not believe that cancer cells and regular cells would have the same frequency. Another patient insisted that his cancer had been properly treated at home with baking soda. He gave me a website like fkillscancer.com or something. The patient also had with them a surgery report in which it appears their baking soda consumption resulted in buildup of abnormal calcium in the wall of the stomach, which had to be removed. Everyone with something stuck in the bum somehow just innocently fell on it. Me, your blood pressure is very high. You need to take the blood pressure medications I prescribed you. Him, I don't need no pills, doc. All I need is Jesus. I am a family practitioner and I had a family not want to vaccinate their newborn because they heard that vaccines were derived from monkeys' brains and they didn't want their child to develop monkey-like characteristics. Had a patient with atrial fibrillation that needed to be on anticoagulation. I chose Pradaxa and patient said, "No, that one does not have any antidote. In fact, it's the only new oral anticoagulant that has an approved reversal agent." Patient refused to believe me, like I got some bonus for killing her or something. Woman had a bad yeast infection. Besides that smell, I also smelled feces. I asked if she wiped back to front. She said yeah, but that's not why I have this. It's from drinking pop. Despite my assurances that it was not from drinking pop, she wouldn't believe me. I said, "Okay, you must be right. I'm just a doctor," and prescribed her the same thing I would have if she was an intelligent person. When I was a medical student, this middle-aged male patient from a rural area got it in his head that I knew absolutely nothing and he was doing me a service talking to me. He was in colorectal clinic for something unrelated and started telling me about the gland on the back of his neck that would drain every so often. When he saw that I was unfamiliar with this particular gland, he gave me this knowing look, laughed and started instructing me, the dumb little medical student, about this gland. Apparently everybody has this gland for the immune system, but that is what drain when he was stressed. No sir, I was being polite, but you have a nasty ducking abscess on the back of your neck. I was hoping that the patient would try to explain this medical wonder to my attending when he came in, but, alas, he didn't. A mother brought her 14-year-old daughter to the ER due to hypergastric pain and spotting. We asked the daughter when was her last period. She said 2 months ago. We asked her for her sexual history, thinking this might be an ectopic pregnancy. The mother kept butting in saying that she is still a virgin and she has no boyfriend. We left it at that, until her mother went out to go to the bathroom. The patient admitted that she had sexual intercourse with a classmate of hers. We requested for pregnancy test and HCG titers. It really looks like ectopic pregnancy. We advised the mother that her daughter needs immediate surgical intervention. She refused to believe us, saying that the lab results are unreliable and untrue. She keeps on saying that her daughter is a virgin. She stormed out of the ER with her daughter that looks really in pain. Patient stated he got a full fellatio at his previous hospital before being transferred to my hospital. Not sure if he was trying to say filleted, in regards to debridement of his lower extremity wound.